Today, we're going to tackle a condition that affects millions of people, but is so often brushed aside or just plain misunderstood: irritable bowel syndrome, or IBS. We're going to pull back the curtain and demystify what's really going on inside the body when IBS flares up.
And to really get a handle on this, let's follow the story of Susan, a 30-year-old nurse. Her story is a perfect example of what so many go through. The struggle with pain and just complete unpredictability started way back in her teens. It's a journey that mirrors what millions of people are dealing with, often in silence.
So, what is really behind all this? Is it just stress? Did she eat the wrong thing? Or is there something much, much more complex going on here? That is the big question we are going to unpack today.
Okay, first things first, let's just get a sense of the scale here. Because while IBS is incredibly common, for a lot of people, it's a very private and honestly a pretty isolating struggle. Just let this number sink in for a second. Somewhere between 10 and 20% of adults and teenagers are living with symptoms of IBS. That is a huge slice of the population. It's actually one of the most common things a gastrointestinal doctor will diagnose. And if you want to know just how much this affects daily life, get this. The pain, the unpredictability, it's so disruptive that IBS is the #2 reason people miss work. The only thing that beats it? The common cold. So no, this is not some minor inconvenience. It has a massive impact on people's lives, their careers, and there's this quiet psychological weight that comes with managing an illness nobody can see. All right, so to really get our heads around IBS, we have to be super clear on what it is, and maybe even more importantly, what it isn't. And the biggest clue is right there in the name: Irritable Bowel Syndrome.
That word syndrome is everything. See, unlike a disease that has a clear cause, like a virus or a bacteria, a syndrome is basically a collection of symptoms that all show up together and create a recognizable pattern. For IBS, that pattern is chronic belly pain, bloating, and then either diarrhea, constipation, or sometimes both.
And this brings us to probably the biggest point of confusion out there. IBS is absolutely not the same thing as IBD, which is inflammatory bowel disease. With IBD, something like Crohn's disease, a doctor can do a colonoscopy and actually see the problem. There's inflammation, there's physical damage to the gut. But with IBS, the gut looks totally normal. And that's the whole ballgame right there. IBS is a problem with how the gut works, not how it looks. It's a disorder of function, not structure. And to make it even more interesting, IBS isn't just one thing. It's actually broken down into different subtypes, and it all depends on what the main symptom is. You've got IBS with diarrhea, or IBS-D. That's what our case study Susan is dealing with. Then there's IBS with constipation, or IBS-C. And for people who bounce back and forth between the two, there's IBS mixed. So if the gut looks perfectly fine, what in the world is causing all this pain and chaos? Well, this is where the science gets truly fascinating. It all comes down to this incredibly powerful and complicated connection between your brain and your gut. I want you to picture a super busy two-way highway. There are signals flying back and forth between your brain and your gut constantly. The brain can mess with the gut. That's why stress can make symptoms so much worse, right? But here's the crucial part. The gut is also sending signals back up to the brain, and those signals can influence everything from your mood to how you actually perceive pain. This whole communication network, it has a name. It's called the brain-gut axis. It involves your main central nervous system, of course, but it also involves something scientists call the enteric nervous system, which is basically a second brain that lives in your gut. These two brains are in constant conversation through a huge web of nerves. And a key messenger or neurotransmitter on this highway is serotonin. Now, we usually think of serotonin as the feel-good chemical in our brain, right? It affects our mood. But get this. The vast majority of your body's serotonin is actually in your gut. And down there, it's a master regulator of muscle movements and pain signals. In people with IBS, it seems like this whole signaling system is just out of whack. So, you have this incredibly complex system that's gone haywire. How do you even begin to treat it? Well, there's no magic pill. Instead, doctors use what they call a stepped approach. It's like climbing a ladder. You start with the simplest things first, and you only move up if you have to. So for someone like Susan, the journey starts on the first rung of the ladder: education, diet, lifestyle changes. If that's not enough to get relief, then you climb to the next step, maybe some first-line meds. If that still doesn't cut it, you move up to prescription drugs, and then finally, for the most severe cases, there are highly specialized therapies at the very top. And let's just look at how specific these treatments can get. For someone with persistent IBS with constipation, there are two main prescription options. Think of them as two different ways of turning on a faucet in your intestines. Lubiprostone directly opens a channel that pulls more fluid in. Linaclotide does the same thing, just in a more indirect way. But for both of them, the goal is exactly the same. More fluid helps get things moving again. But what about really severe cases, like Susan's, where the diarrhea and pain are just constant and debilitating? This is where you get to the top of that ladder, where the treatments are more powerful, but they also come with much bigger risks. So one of these powerful options, used just for women with severe IBS-D, is a drug called allocetron. Remember our serotonin highway? This drug basically acts as a roadblock for one specific type of serotonin receptor. The result? It slows down the colon and dials down those pain signals. But, and this is a huge but, its power comes with a major warning label. The FDA requires what's called a black box warning on allocetron. That is the most serious warning they can issue. And it's because the drug carries a risk of a rare but potentially deadly side effect called ischemic colitis. So what's the actual risk we're talking about? Ischemic colitis is a condition where blood flow to the colon gets dangerously low. It happens in about 3 out of every 1,000 patients who take this drug. Now that's a small number, for sure, but the potential outcome is so serious that this drug is only for the absolute most severe cases, where nothing else has worked. And beyond these really targeted drugs, there are other tools in the toolbox for pain. Things like antispasmodics, peppermint oil is a common one, can help relax the muscles in the gut. And then there's this really fascinating approach, using low doses of certain antidepressants. Now, doctors aren't using them to treat depression here. They're actually using them to sort of hack the brain-gut axis and change how the brain is processing all those pain signals coming up from the gut. Okay, so after diving into all that, what's the one big thing you should walk away with? Let's bring it all home. If you remember one thing from this, let it be this. IBS is a real, legitimate physiological disorder. It is not just stress. It is not all in your head. It is a complex breakdown in that critical communication system between the brain and the gut. And just understanding that is the first, most crucial step toward finding a way to manage it effectively. And all this leaves us with a really fascinating question for the future, doesn't it? As we get better and better at understanding this intricate brain-gut axis, where are the next big breakthroughs going to come from? Will we find them by treating the gut itself or by rewiring how the brain listens to it? The answer to that could change everything for millions. Thanks for joining us for this explainer.